A 42-year-old woman at 10 weeks gestation comes to the physician for an initial prenatal visit. Physical exam shows a uterus consistent in size with a 10-week gestation. This patient is at increased risk for a child with Down syndrome if she has which of the following sets of ultrasound and serum findings. The first thing we see is the fetal ultrasound nuchal translucency. This is going to be increased with Down syndrome. This test is going to measure the tissue that is going to be behind the unborn baby's neck. And so the increase in size is going to be a indicator for a autosomal disorder like Down syndrome. So that is going to be increased with Down syndrome. As a result, we can cross out answer choices D, E, and F. Now we see pregnancy associated plasma protein. Pregnancy associated plasma protein is going to be low in the serum with autosomal trisomies. So all the autosomal trisomies we see, including Down syndrome, is going to have a low pregnancy associated plasma protein A level. And the mnemonic that you can use to remember that Papa is going to be associated with low serum levels is that Papa is down because the baby might be sick. So with autosomal trisomies, Papa levels are going to be low. Now let's move on to human chorionic gonadotropin. Now, if you remember the mnemonic bi is high with Down syndrome, bi refers to beta HCG, I refers to inhibin A. So beta HCG and inhibin A are going to be elevated with Down syndrome. So our answer choice is ultimately going to be A as a result. Now, the other autosomal trisomy levels that we need to know for step one are going to be Edwards syndrome and the Patau syndrome. So, Edwards syndrome is going to be trisomy 18, and the way you can remember this is E for Edward, and so election age is going to be 18. So, you can remember Edwards syndrome for election age being 18. For trisomy 13, Patau syndrome, you can remember the mnemonic puberty age 13. So the P is going to be for Patau syndrome, and you can remember that Patau syndrome is trisomy 13 by remembering that puberty age is usually around the age of 13. Now, the levels you can remember with the mnemonics below 13. So with trisomy 13, the only thing that is going to be decreased is going to be beta HCG. So B for beta HCG. So we don't want to be below 13. Other hormone levels are going to be normal. With Edwards syndrome, we can remember the mnemonic ABE is 18. So Edwards syndrome is chromosome 18, and the hormone levels that are going to be less than normal are going to be alpha fetoprotein, beta HCG, and estriol. So A, beta, and E. Abe is 18.